Hi.
So we're here on behalf of the team that's actually providing the care because today is Wednesday, which means it's the busiest clinic day for this population. And none of them could get away today. So I'm the director of the Department of Psychiatry at Dartmouth-Hitchcock, and Susie is the program manager for kind of all things related to addiction medicine these days with psychiatry. This project is an expansion of something that we've been started maybe 4 or 5 years ago, of focusing on pregnant women, perinatal women with addictions, and getting them on medication-assisted treatment while they're pregnant, and then all of the wraparound services that they need to really have a better delivery and then better outcomes for the baby down the road. So what this program is to take what we had been doing 1 day a week and set up an intensive outpatient program for the women that need more than 1 day a week, and add the resources of a resource specialist, someone to help connect them with other resources in the community, a recovery coach. I've done all the other people we have in it. We have a licensed social worker who leads the group. We have a psychiatrist who's doing the prescribing of the MAT. We have a nurse midwife, APRN, who is helping to do the prenatal checks and postnatal OB care, GYN care, and we also have a pediatrician that is on site to help with baby checks if the baby is part of the DH system. It's still growing. We have 2 patients. Yay. It took us a while to kind of get the staffing in place, but it's a very engaged and passionate group of providers that dream really big and want to do so much for this population. And it's sometimes hard to keep up with them, but we've done thanks to Stephanie and Jessica, we've been able to kind of get them a little bit more focused. But we're looking forward to really the active groups kicking off soon. With the 2 patients that are enrolled right now, it's still more individual intensive outpatient because 2 does not make a group. But when we get number 3, we'll have number 3. There's lots of community resources and partnerships that are also interested in helping this. There's a food pantry within the practice for the women to get food to bring home. There's a diaper service, they can bring diapers home. I think lots of people have donated baby clothes and baby toys. We have now a closet that's a little overwhelming, but the women can really just get what they need. There's some resources over here on the table and some information about the program too. Do you want to add anything else?
Just we're ready to accept your referrals. And it is an incredibly passionate group of providers.
Yeah.
It's just amazing.
Oh, the other thing we were talking about during, Tanya, your fabulous presentation is we do have a patient advisory board that we're hoping will be successful. They've met a few times, but it's women who have been through the 1 day program over the past several years and really help with the here's what worked, here's what doesn't work. One of the pieces that I forgot to mention was we have family support, and we call it family support because we're not allowed to call it child care, but we have a person on site who will hold the babies in another room with some volunteers while the moms are getting the treatment, because that was a limitation to care of what do I do with my baby during this time. So really collecting the feedback from the women of what would help you be more successful in your care, and let's see if we can get that incorporated into the program. So, yeah. So, thanks.